Hello, my name is Kerry Bernard, and I would like to introduce you to medical terminology that you will often encounter in the healthcare field. Now, medical terminology is going to be vital to understanding anatomy and physiology. It's going to be important for understanding clinical testing, which goes on in the healthcare field. It's going to be important for understanding medical billing and coding. And so we can't underestimate the importance of medical terminology. It really unleashes all of what we'll encounter on a daily basis in the healthcare field, whether you're working from a clinical standpoint or from an administrative standpoint. And one of the first things that we have to determine when we are looking at anatomy and physiology is we have to determine if a word is a decodable term or a non-decodable term. Decodable terms typically have a prefix, a word root, and then they have a suffix. For example, we have arthro. Okay, that's a combining form, and it has a suffix itis, which means inflammation. We can combine that into one term, arthritis, and we will understand that it has a meaning of inflammation of a joint. We would refer to this as a decodable term. Again, decodable terms are going to be broken down into a prefix, a word root or combining form, and suffix. I'll often use word roots and combining forms interchangeably. A word root and a combining form give the word its meaning. A combining form simply adds the combining vowel to the word root. So in the example that we just used, arthro is the combining form. If we just had ARTHR, that would be the word root. But it's a combining form or word root for joint. Now, not all words will have a prefix, a word root, and a suffix, but they will all have to have a word root, something that gives the word its underlying meaning. It may lack a prefix, it may lack a suffix, but typically the combining form will have either a prefix or a suffix. Okay, there's not very many examples where there is just simply a combining form. Now, these again are called decodable terms, terms that we can break down. These terms, if we learn the basics, make up most of the terminology that we will encounter on a regular basis when we are unlocking medical terms that we encounter on a regular basis in the healthcare field. In this particular example, we're going to have micro as a prefix, the combining form scopo, which means to view, and then finally the suffix y at the end of our term, and we are going to combine a prefix, a combining form, and a suffix to form the word microscopy. Okay. Microscopy. And that obviously is going to be pertaining to viewing something small. Okay, everybody's probably heard of a microscope, and with a microscope you can perform microscopy. But again, this is an example of a word that contains a prefix, micro, a combining form, scopo, and a suffix pertaining to. And again, this is an example of a decodable term. This is a decodable term. We will run into terms which aren't decodable. Cataract, for example, isn't a term that can be broken down. Cataract can't be broken down into a combining form and suffix or prefix combining form and suffix. So again, we refer to it as a non-decodable term. Those are a little more tricky. They practically just come with practice. You have to just know the terminology associated with the field to be able to understand what a word like that would mean. Okay? But again, becoming more familiar with the decodable terms really helps non-decodable terms stand out and gives you a better opportunity to break words down and fully grasp the material that is in a patient's chart or on a patient's order, and let you more fully have advanced knowledge of what you will be working with. This is lesson 1, an introduction to medical terminology associated with the healthcare field. We're going to be exploring more terms, but right now we want to focus on decodable terms. Terms which contain a prefix, combining form, and a suffix. So thank you, and I look forward to seeing you next time.